Grace, thanks. And as everyone prepares for back to school, it's important that kids have all of their questions answered about the pandemic and changes that they might see come the fall. Here to talk with us about some of the helpful tips is Dr. Caitlyn McLear, who serves as clinical psychologist at Synergy Psych. Doctor, thanks for joining us this morning.
Thanks so much for having me.
Absolutely. Well, the first question would be about the pandemic as it continues, and the talk about it is everywhere. What are the best way parents can kind of bring their younger children into the discussion and talk about COVID-19?
I think a really important point is to remember not to be afraid to discuss it. Really ask your children what they've heard. Kids are listening all the time, and so this is a really great time for them to ask questions, you to answer questions, and for you to model just appropriate emotional responses and just how to manage any kind of anxiety around it.
Yeah, absolutely.
Like developmentally appropriate, and just be honest and open, even if you don't know the answer.
Absolutely, kind of exploring it together. Now, there is a lot of anxiety about this, and we have been living with this for months now, and some would call it the new norm. But what can we do to kind of cope with it all?
I think it's connecting with others, whether it's virtually or kind of at a safe social distance. Just sticking to your old routines, having a goal and a plan for every day. Do stuff to take care of yourself. Kind of focus on the present rather than all the what ifs.
Yeah, absolutely. Kind of staying positive and looking to the future even more so. With young kids being in summer programs, they'll eventually return to school and normal activities soon. How can you discuss with them wearing masks and practicing social distancing and things, something that they might not understand right away? How can you kind of present that to the young ones?
We've talked a lot about using masks and social distancing and comparing them to other things we do to stay safe, like washing our hands, going to the doctor, those kind of things. So using really simple terms, talking about what the purpose is to protect yourself and others from the virus and other germs. And then with masks especially, we want kids to practice. So have them wear it around the house a little bit, put it on their stuffed animals, reward them even for trying to wear it for small amounts of time.
Yeah.
And just kind of a little bit part of life.
Absolutely. Now, not just the young kids being affected by this. We know the disease has been spreading among 20 to 30-year-olds. And in this age range, what would you tell this group in terms of the dangers about COVID-19?
Well, we know this group is perceiving themselves as less vulnerable just because they don't experience as severe symptoms. That doesn't mean it doesn't spread as easily. So I'm really trying to help them understand the importance of doing some of these safety measures to protect those they love who are at risk and who are more vulnerable. And two, just encouraging them to seek out credible sources, because we know there's a lot of information out there, a lot of contradictory information too.
Yeah, and wanting just to kind of keep that discussion going with them. Lastly, with college students going back to school in the fall, a lot of parents might be nervous, especially for their freshmen. What advice would you give to them in terms of sending the young ones off, or now no longer young ones off, for their first year in college, perhaps?
Yeah. Definitely. I think, first and foremost is figuring out what their college or university is doing to keep its students safe, and then talking to your child about that and talking through with them about a safety plan. And then two, just kind of seeing how they're feeling about it. Like, college is a huge transition already, and then adding this on top is probably going to cause a good bit of anxiety. So I think it's just having that open dialogue and making a plan.
Yeah, absolutely. And make the plan together. It's something I think none of us have experience with, but of course, wanting to kind of walk each other through that. So, Dr. McLear, thank you so much for joining us this morning.
Thank you.
Now,